Hey everyone, it's Adam Farkas back here with you, and again I have Dr. Kevin Henne with me. And so Kevin, we're going to talk about something totally different this time. I want to talk to you a little bit about multifocal fits. I heard a stunning fact yesterday in a lecture that, I'm going to try to get this right, the majority of multifocal contact lenses are fit by, I believe they said, about 13% of the practitioners in the country. My question to you, I guess to start out, is why?
That's a good question, and I was shocked by that statistic also, and they defined that 13% of practitioners that are fitting the multifocal lenses as fitting one or more per month. So it's a very low threshold, so they're just not fitting the lenses.
And you know, the knock on the lenses in the past, or the stereotype that people always brought up, well, these are hard to fit. It'll take forever. The chair time's, the outcome's terrible. So what do you say to that?
Back in the early 80s, I remember fitting these lenses, and they told us success rates were 5 to 10%, and we really didn't want to fit them. When I got up to 20-25% success, we started talking about it and fitting a few here and there. Nowadays, we're up past 70, we're up into 80 to 90%, so we don't have to tell the patient, hey, you won't be able to see, they're not that comfortable, and you're not going to really like them, but let's try them anyway. Now we say, hey, these lenses are fabulous. You're going to see very well.
So when you actually do see a patient, typically these days when you're doing a multifocal, how much chair time really is involved?
Very little more than what I've had to do with fitting single vision lenses. So we put the lenses on, let them settle, see how they're doing, and if it's borderline, I'll say, hey, let's go with it and see how it goes. And invariably in a day or two, they call back and say, order my lenses.
Right.
Occasionally that we have to make a little modification on the power, and oftentimes I can do that on the phone, so it doesn't really take up much chair time at all.
Right, so it's gotten much easier. So what do you see the benefits being to not only the patient, but the doctor as well for fitting multifocals?
I enjoy fitting the multifocals as much as anything, because I remember the days when we didn't have a lens that really worked. So it's extremely exciting to have a lens that actually works. I have patients, I'll say, well, what do you think about multifocal lenses? They say, well, we tried those 20 years ago. I said, this is not that lens. This is a new lens, and they're quite amazed when they put the lens on and wear it.
Right, and we have a whole cohort of people that are now sort of moving into presbyopia. I'm one of them, right? You can see the grays coming. Do you market the lens a little bit differently to patients these days than you might have in the old days?
I would say so, knowing that we've got an 80 or 90% chance of success. And it's opened up a market of part-time wearers also, people who may enjoy their glasses but want to have them for social or for sporting events.
One thing that I heard was that the patients that you can fit successfully with these lenses are your most loyal, and they're the most likely to blab about you to their friends, because their friends notice, hey, where are the readers? What happened?
It's so true. So true, yes.
So would you have any advice? I mean, we want to try to boost this from 13% to something a little better. So what advice would you give for someone who's just sort of dabbling with it?
My best advice was these lenses work, 80 to 90% success rates. Patients are going to be happy, you're going to be happy, and these contact lens patients are lucrative patients. They tend to buy glasses, they buy contact lenses, they tell their friends about it, and they're your biggest promoters in your practice. So it's been a great positive benefit in my practice.
Great. All right. Well, Kevin, thanks so much.
Thank you for having me.